My name is Cathy Von Hippel, and I am a clinical psychologist and a partner at Alaska Telepsychology. Remarkably, Danielle Allen and I launched our telehealth clinic in July of 2018, far in advance of the coronavirus. And at the time, the idea of a telepractice was edgy and for some, frankly, outrageous. Now, of course, telehealth has become mainstream. For the last several months, and probably a lot like you, my mind has been swimming with thoughts about the impact of the coronavirus on society at every level, nationally and globally. This is especially the case because my daughter and I contracted the coronavirus early in March, making us some of the first diagnosed in our community. That experience gave me pause to reflect plenty on this pandemic and its particular meaning for me individually and for us as Alaskans. And I'm sharing my thoughts on this today. When I was sick, my symptoms were so strange, so unexpected, so surreal, that I found myself repeatedly thinking about the War of the Worlds. Do you remember the War of the Worlds? The War of the Worlds is a science fiction novel written by English author H.G. Wells and serialized in 1897. This book was memorably dramatized in a radio program that caused mayhem in 1938 as disoriented listeners panicked in the belief that a Martian invasion actually was at hand. The novel famously influenced the work of scientists, notably Robert Goddard, who, inspired by the book, invented both the liquid-fueled rocket and the multi-stage rocket, which resulted in the Apollo 11 moon landing 71 years later. 71! Today, the coronavirus pandemic, like the War of the Worlds radio show, has completely disoriented Americans and shifted our economy. Epic loss of life, economic collapse, school closures, stay-at-home orders, and uncertainty about our future feels like the end of life as we know it. But life as we know it has ended before in Alaska. Lasting 4 minutes and 38 seconds, our 1964 magnitude 9.2 earthquake remains the most powerful earthquake recorded in North American history. Anchorage sustained tremendous damage to many houses and buildings, especially in landslide zones along Knik Arm. The Turnagain neighborhood lost 75 houses in a landslide, and tsunamis generated by the earthquake caused an estimated 122 deaths, killing people as far away as California. Less than 1 hour after the earthquake ended, radio announcer Jeannie Chance went on the air at the damaged but still functioning KENI radio station. Jeannie Chance broadcast for 59 continuous hours. 59! Providing rescue information, coordinating response efforts, and helping to reunite families. Who was Jeannie Chance? Jeannie Chance was a hero, a woman who emerged from complete wreckage with a vision to act. And I've been thinking about her and thinking about the idea that across time, place, and history, unexpected people have been pulled to unexpected heroism. Of note, most recently in 2020 is Li Wenliang, the Chinese ophthalmologist villainized by his government for issuing private warnings to colleagues about the emerging coronavirus epidemic in Wuhan. The police in Wuhan summoned and admonished Dr. Wenliang for allegedly making false comments on the internet. He was returned to work where he contracted the coronavirus and subsequently died. Across the globe here in Alaska, public heroism is easily witnessed in healthcare providers as well as epidemiologists, policymakers, etc. Less visible during this pandemic are everyday acts of private heroism. Social distancing, quarantine, and isolation to slow the spread of the coronavirus are private acts of heroism with costs that include lost income, physical deconditioning, loneliness, fear, anxiety, depression, and anger. This pandemic is both terrible and an opportunity to improve our mental health habits and to model resilience for others. Resilience is the capacity to recover quickly from adversity. Resilience is our bounce back and a skill we can practice. I've come to the conclusion that our opportunity as Alaskans is to emerge from this wreckage with a vision to act, like Jeannie Chance. We can shift our narrative so that we are agents, not victims. Keep calm and carry on sounds great, but most of us wonder how. 5 simple thinking habits are a smart start towards resilience, and I recommend these to you. 1. Alaskans must accept that change is part of living. Oil prices are at an all-time low and production is down. Paying income tax and locating additional sources of revenue are inevitable. 2, Alaskans must avoid seeing crises as insurmountable problems. Many of us are subsistence hunters in one of the most inhospitable climates in the world. Our children reroute when they encounter moose when walking to school. Bears root around in our trash and trucks, and still we manage. 3, Alaskans must focus on what we can control. Children can choose which book they read and whether they shower before or after dinner. We can exercise, eat healthy food, and breathe freely in nature. The coronavirus has not damaged our wilderness. Our wilderness remains pristine. 4, Alaskans must take decisive action. We must organize informal summer camps with trusted neighbors and their kids. We must change our business plans, apply for unemployment, look for work, network, ask for advice, budget, and sell our junk on eBay. 5, Alaskans must maintain a positive outlook. Scientists are sharing information. Companies, universities, and governments are developing vaccines. Public consciousness has been raised. Past plagues, such as influenza, bubonic plague, and typhus, have been resolved with vaccines and medical treatments. We can take heart in the historic reality that pandemics don't last forever. Alaskans, please reflect. Out-of-the-box thinking brought us the 1925 serum run to Nome. That community response to a diphtheria outbreak involved transporting a 20-pound cylinder of serum by train 298 miles from Seward to Nenana, and then 20 mushers and more than 100 dogs relayed the serum 674 additional miles from Nenana to Nome. When I was sick with the coronavirus, I had the Denali of headaches for a week. My head was its own landscape in the dead of winter with no sun in sight. During that miserable time, it struck me that Alaskans have collective muscle memory from a long, proud history of resilience. And we can, I can, you can, therefore, each of us can step up now. Change is part of living. Crises are surmountable. There's much we can control. We can take decisive action, and we can choose to be positive. Thank you for hearing me out. From my home quarantine to yours, this is Cathy Von Hippel of Alaska Telepsychology, wishing you and your family good health.